Patients with sickle cell are the most undertreated patients in emergency medicine, and that community is one of the most underserved patient populations in medicine. I said what I said. Services that don't have sickle cell protocols, or at least considerations for patients with sickle cell within their specific protocols, are most likely contributing to these patients being undertreated, because these patients are simply getting lost within other protocols like pain protocols. Sickle cell disease is when the chemical structure of hemoglobin within a red blood cell causes that hemoglobin to become twisted, and it pulls the red blood cell into a sickle shape. The loss of the aquadynamic shape of those red blood cells causes red blood cells to pile up in the capillaries, preventing forward blood flow. Additionally, red blood cells, which attempt to bounce back from this shape, they do attempt to reshape themselves, but the continuous process of attempting to reshape themselves causes them to die much earlier than your regular healthy red blood cell. And this significantly impacts a patient with sickle cell disease's ability to transport oxygen. And this can result in many different presentations, which require different forms of pain management, oxygenation, ventilation strategies, and even blood transfusions. And sickle cell crisis can present in various forms that are isolated to either one or a combination of other types of presentations. It can be limited just to the extremities. They can present with acute chest syndrome related to sickle cell crisis, where they may need to get put on CPAP or BiPAP. They can present with a severe headache where they are actually experiencing a stroke. They can present with a severe and painful priapism that's actually life-threatening. And the other thing is that your 50 micrograms of fentanyl for an adult or your 1 milligram of morphine for a pediatric isn't going to touch this pain. Your conservative protocols are not good enough. Patients with sickle cell disease have a chronic and life-threatening disease that causes an unbearable amount of pain and suffering, and EMS needs to start respecting that in our protocols.